Hello, everybody. Uh, I don't know what time is it where you are. I assume if you're in Nairobi, I assume it's good evening. So thank you everybody joining us from wherever you're listening from, across the globe or across the country. Welcome. Welcome to this webinar that has been arranged in partnership with APN and KEPhSA. So just before we start, we're just going to have like a few housekeeping rules. We are pharmacists, or we are training to be pharmacists. So we are obviously going to treat each other with the respect that this profession demands. So the housekeeping rules, this session is going to be recorded and it's going to be shared for future references. And it's also going to be posted to the YouTube page of APN. So if there is something that you're interested in revisiting, you can always find it. It's also going to be, there's a link that is going to be shared across the KEPhSA pages. Your microphones are supposed to be off throughout the entire session, unless it's the Q&A part. It's the only time that you're supposed to be having your microphone off. This is not to make it like a one-sided conversation, but rather to reduce the background noise, because probably I live next to a construction site, so there's no need for everybody to hear hammers in the background. So the chat feature is going to be used for the Q&A session, whereby questions that you have are going to be posted towards the individual speakers and they're going to be answered at the end of the session. So you can just post a few of your questions in the Q&A. And if we are going to have a few speakers, I don't want to spoil them, but let me just use as an example. So if during Dr. Juliet's presentation, you have a question, so you can just address the question specifically to her, such that she can answer your question towards the end. So we are obviously going to be engaging respectfully, treating each other in a manner that demands some sort of like respect. So if there's any feedback, there's an email that is at the screen. You can send the feedback to the email, or we'll provide the KEPhSA email so that you can use that also for feedback. So just a brief teaser of what we are expected today. This year's theme for World Pharmacy Day is Think Health, Think Pharmacy, Think Pharmacists. There's this slogan that we have during our World Pharmacy Days: students today, pharmacists tomorrow. And the Federation gave out that the theme so that we can recognize pharmacists as healthcare professionals, because traditionally pharmacists are usually at the hindsight in terms of making drugs, dispensing. The only time that we come to a really good contact with our patients is usually explaining to them how the drugs used. But how can we as pharmacists be at the foreground more? And we're also going to celebrate and highlight the roles in the sustaining of the health systems. So just to give you a brief, what are you, when you're coming for World Pharmacy Day this year, what is expected of us? As in, what do we have this year in store for you in the 2025 WPD? I hope that most of you have attended WPD, and I'm directing this to the students. I hope most of you have attended WPD. And if not, finally, it's now time for you to have a taste of WPD. But we have already started. So 1st September, today, we have launched our WPD month, and we're doing it in style with this webinar. We have launched our WPD month this year. What are we expecting from WPD? As for we know, 12th September will mark the pre-Olympiad, where we're going to do the exams. So, but then these exams are being done early, such that the day is not really focused on doing examinations, but just interacting. So 25th September is the World Pharmacists Day, but since it's a weekday, we'll not be able to hold the event. So it's being pushed to 27th September, where all roads will lead to University of Nairobi, at 8 a.m., where we'll have our traditional WPD, just a small session with side events, team building, the winners to win, and yeah, we'll have to go back. So I think I have exhausted what I just wanted to give you a teaser of what you're having today. And yeah, so I will welcome our first speaker, Dr. Juliet Ouma. I don't want to start blowing other people's horns, so I will just give this opportunity for Dr. Juliet Ouma to introduce herself, to tell us a little bit about APN. And yeah, so if there are any questions, again, as a reminder, please post them in the chat box. And if you're directing them to her, just write who you're directing the questions to. Definitely they'll be answered at the end of the session. So welcome, Daktari.
Thank you. Thank you so much, Hilda, for the introduction. My name is Juliet Ouma, although I am not a pharmacist, but I do work with pharmacists at my place of work. I am the Programs Assistant at African Pharmaceutical Network, and it's a pleasure to meet each and every one of you. And thank you for making time to be here with us this afternoon when we prepare ourselves for the World Pharmacist Day, in honor of celebrating each and every one of you. Even though you're a student, you still matter, and you've taken the opportunity to study pharmacy so that you can become an excellent pharmacist. So I appreciate each and every one of you. So quickly, I'll take us through the overview of African Pharmaceutical Network, who we are as an organization, our reason for existence, and the kind of work that we do. I know most of us, if not all of us, have already interacted with the African Pharmaceutical Network, but who are we? Who are we and what do we do? So African Pharmaceutical Network is a pan-African network that convenes pharmaceutical stakeholders for the purpose of knowledge sharing, policy shaping, and innovation nurturing partnerships, all leading towards reliable access to safe, effective, and quality medicines in Africa. African Pharmaceutical Network was established in 2020 with the desire of addressing 3 specific challenges in the industry. And the 3 include limited local manufacturing in Africa. This is attributed to capacity shortfalls in the continent. We know that Africa as a continent is the 2nd largest continent after Asia, but we have so many challenges within our health sector and our pharmaceutical industry. And one of them is high disease burdens. But when we are having these high disease burdens, there is the need for proper medication and proper pharmaceutical instruments or pharmaceutical products, whether it's medicines, whether it's medical devices, there is need for these particular things. Yet as a continent, we rely on imported drugs, finished products to up to 80%. So it is not sustainable for us as a continent. So for us as APN, we saw that there is need for the pharmaceutical workforce in Africa to be well capacitated, to have the right knowledge, the right skills, and also to enable the environment within the continent itself so that you are able also to practice within the continent. We have seen our colleagues, maybe our family members as well, who have studied pharmacy, but they have opted to go and practice in a different continent. And we could ask ourselves, what is the reason behind this? Someone might say that the industry within Africa is not as lucrative as the industries in other continents. So we also need to make sure that the environment within the continent, the pharmaceutical industry itself, also enables professionals to practice within the continent. The second issue was on segregated and disjointed pharmaceutical systems, strengthening interventions across sectors and domains within the industry. Right now, if I ask you as a pharmacist, what kind of a pharmacist would you like to be, or in which particular field would you like to practice in? I know there are those of us who have an interest in RA, others in PV, supply chain, QA, QC. You have an interest in those, and you want to practice within a manufacturing setting. But when we look at how disjointed the continent is when it comes to these particular fields, it continues to pose a challenge for us to be able to advance and get to the place where we are competing globally with the other continents. So when we are seeing the particular disconnections within the industry, for us as APN coming together to say, you know what, we don't need this. What we need is for each and everyone to work together and ensure that we are promoting reliable access to safe and quality medicines while working together. As a person in QA, as a person working in pharmacovigilance, we need to be working together. Then lastly, there was an issue of the lack of a single common platform to convince stakeholders to chart a path for the future of the industry. Therefore, APN was established as a Pan-African networking organization. And that is why we are also having this industry discussion this afternoon in partnership with KEPhSA, that we are offering a single common platform where professionals can come together, even with pharmacy students, that we may be able to ensure that we are bridging those gaps and ensuring that the next person who will pick up from me, next person who will pick up from Kelvin, also has that ability to continue the good work that started. And it can only happen if we are coming together to chart a path. We are coming together to have these discussions that are critical and very crucial for the sustainability of the industry. So what is our mission and our vision as APN? Our mission is to ensure reliable access to safe, effective, and quality health products. And this is for everyone within the African pharmaceutical industry. And we do this through strategic investment in pharmaceutical workforce development, business ecosystem support, and policy shaping interventions. I'll be speaking about this shortly. And our vision is reliable access to quality, safe, and effective medicines in Africa. It is all about ensuring that our patients continue to have access to safe and quality medicines. If we are going to make an impactful work, if we are going to make an impact in our continent, in our different industries, we must ensure that we are meeting the needs of our patients. This is by ensuring that they have access to the best products that can be made available to them. Our values include humanity. Before everything else, we are human beings. So before I meet you as a professional, or the professional that you are, I must interact with you as a human being. I should be able to have the mindset or the capability to understand that my relation with you is to know that you are a human being, and I ought to treat you respectfully. I ought to treat you with love, with care. So beyond anything, I know that you are a human being. Then we have integrity, and we believe in doing things the right way. Things must be done the right way. If you're leaving school and you want to practice, what is the right process of doing this? If you're practicing, how then ought you to practice? Then we also have professionalism as for us as an organization, where we continue to interact professionally with each and every person that we meet, regardless of who they are, whether they are students, whether they are professionals, whether they are patients, or whether they're just our clients in different capacities. Then we have client value creation. When you interact with us, you'll definitely find value. Then we also value teamwork. We work in unity as African Pharmaceutical Network, and we extend the same through our partnerships. If you're working with KEPhSA today, we ensure that we are always coordinating our work amongst each and every team that there is. Then our journey as African Pharmaceutical Network, APN was established in 2020, like I had said. So in 2020, that is in the backdrop of COVID-19, the vision of APN was crystallized, and we had the foundational principles of how the organization would run, the kind of work that we'll be doing, and the vision that we'll be working towards. Then in 2022, we convened our first industry discussion forums with key industry players, including IFPMA, Bloom Public Health in Nigeria, FKPM in Kenya. And then in 2022, we were able to sign a partnership agreement with Empower School of Health based in Geneva. This also helped to support the kind of work that we are doing in pharmaceutical workforce development, so that when we are speaking of partnerships with those who are with key industry players who are also working towards the same goal, we also assess the industry to find key industry players who are also working towards the same goal as African Pharmaceutical Network. Then in 2023, we launched the Pharmacy Academy with our first professional course, which was the Regulatory Affairs course. And we also signed an MOU with H3D Bloom Public Health as well. Then in 2024, we were able to scale up the academy as it was. Initially, we had one course, but right now we have two courses. And we also rolled out our market research and advisory support services to pharmaceutical companies within the industry. And we also signed up our MOU with ISOP Africa chapter to strengthen pharmacovigilance systems in Africa. So what is it for us in 2025? In 2025, our focus was on operational excellence in the Pharmacy Academy, and KEPhSA as an organization has come on board as a partner with African Pharmaceutical Network to be able to see that which we are bringing in so that we are able to see through the kind of work that we are bringing in the industry. So when we are saying we are focusing on operational excellence in the Pharmacy Academy, we must also be meeting the needs of those who require our services as well. So our services in broad, we have the pharmaceutical workforce development, regulatory support services, business ecosystem support, and policy shaping. And this evening, as a student, first of all, the place where we are keen on is on ensuring that you have the right knowledge, the right capacity, the right skills for you to function as a professional. So under the Pharmacy Academy, this particular work is well executed under the Pharmacy Academy through courses, corporate trainings, industry discussion forums such as this, and so on. Then we have regulatory support services, where we offer regulatory services and pharmacovigilance support to pharmaceutical companies in the industry. Then business ecosystem support, where we also support businesses to unlock their values within the industry, and policy shaping and partnerships, such as the partnership that we are having this afternoon with KEPhSA. APN is also a membership organization. APN is also a membership organization, and you might ask yourself in what kind of manner. So we have individual membership, and this is distributed in two categories. So we have the student membership and we have the professional membership. The student membership caters for students who are in their final year of study and they are pursuing either a degree or a diploma in pharmaceutical sciences, in pharmacy, PharmD, or biological sciences. So they can be able to sign up under the student membership, and the fee is $25 US. And then we have the professional under the individual membership. So this is for all professionals who are already practicing and working within the industry. The benefits are training opportunities at discounted rates. Instead of having to train with us at the cost of $300 US, you'll definitely get to enjoy our discounted rates as a member. And then you'll also have access to professional networks and professional development opportunities, including jobs that are also posted and through connections as well from the network. Then we have access to business consulting opportunities and referrals, and thought leadership and industry leadership opportunities. We also have institutional membership, and this is for different kinds of companies, whether they are African-based companies, international companies. They can also get to sign up as members of the African Pharmaceutical Network. So who are our partners? And in this journey, when you're speaking about partners, it is that you do not walk alone. We ensure that an individual does not walk alone. So we come on board, or you come and join us, and we continue the work and work together. So our partners so far, we've had industry associations such as IFPMA. We have professional associations such as FIP, the African Pharmaceutical Forum, PSK, Pharmaceutical Society of Zimbabwe, and this year we were able to sign our MOU with KEPhSA, and Kelvin will be speaking more about that partnership. Then we also have research and development partners, academic institutions, and corporates, including agriculture, the SPAC, and Bloom Public Health. So I want to stop there on my presentation when it comes to the overview of African Pharmaceutical Network, and I'll be sharing our links with you. You can get to connect with us on LinkedIn, you can connect with us on X, you can visit our website, get to see the kind of work that we are doing, and where is it that you can get to plug in. We are welcoming you to come on board as well, even as an individual. Don't shy off. Just you have our emails. As you can see, we have the African Pharmaceutical Network at gmail.com. You can reach out to us through that particular email, and we'll be able to see how we can work together. And with that, I am handing it over back to you, Hilda. Thank you so much.
That was quite a good presentation, a really powerful one. Just to confirm, if members are really listening, just use the emoji below and describe what do you feel about the presentation below, as in just use some sort of emoji and describe what you felt about the presentation that has been there. People are really listening. So that was an interesting conversation. That was a really good presentation. And I'm sorry for calling for mistitling you. You have hung around pharmacists for so long. The title has started rubbing off on you. I'm sorry. So so I think it's so encouraging to see that these steps are being made out here. The milestones that you guys have made is what picked to me, and it is what that is giving us a ray of hope that of some sort of a bright future that is ahead. Because look at the milestones that you've made. I just had to look at the screen and I'm like, wow, this is quite amazing. And you said that you were founded in 2020 and just 5 years. That is actually really good. And personally, I'm happy to be like part of this and part of this. So let us now shift the floor to Levis Gitau. Gitau is no stranger to us. He is the KEPhSA president 2024-2025. So he'd just like to introduce KEPhSA, tell people a little bit about the Pharmacy Students Association of Kenya, such that if we are walking out here and you tell people I'm part of KEPhSA and then they ask you, what is KEPhSA? You have nothing to say about it. No, we'll not have done a good job. So quickly to Levis Kitau, the floor is yours. The floor is open to you.
Hello, hello. Can you guys hear me? Hello.
Hello, we can hear you.
Oh,
Loud
okay.
and
Nice,
clear.
nice. Thank you. Okay, so maybe I can just confirm if also Karen is in the room with me. Maybe Karen, if you're there, you can send a reaction, or we can just proceed.
Let me just confirm that for you quickly, that she's in the room. Karen,
Okay,
Karen
in the
is
meantime,
in
I
the
can
room.
just. Okay. Okay, yeah, so I think I'd like for my presentation to be done by Karen. I'll do the introduction on KEPhSA. Just as Hilda has prompted, and then I'll hand it over to Karen, and I'll explain why I'm handing it over to her in just a moment. So let me just switch on my camera in just a moment. Okay. Yeah, I hope yeah, it's okay now. So good evening, everybody. My name is Levis Gitau Kimonyo, the current president of KEPhSA Kenya, and just a moment. Yeah, sorry. So my name is Levis Gitau Kimonyo, the president of the Pharmacy Students Association of Kenya, and KEPhSA is the umbrella body that represents all pharmacy students across the country. And it's an honor to be able to organize such an amazing event for all for all of our members, so that they can be able to enjoy the event and be able to know what it means to be a pharmacist within the field, be able to know it's not just about dispensing medications, and it's not just about writing 1 times 1, it's about patient care, and it's about also safe medication use, and it's also about research and development. There's so much that the pharmacy has to offer, and that's where KEPhSA comes in. We come in to be able to provide all pharmacy students across the country with a memorable experience as they study pharmacy. Our objectives are quite many. I really don't think if I was to start going through them all, we might be here until evening. But one of the key things that we have tried to focus on this year is being able to avail information and opportunities to our members on what you can do beyond class, or how what you're doing in class can be applied in the field. And we're hoping that this year World Pharmacy Day will be able to show you just that and be able to inspire you to make your mark within healthcare and be able to pursue that dream or that vision that you have for seeing healthcare improved in Kenya. We hope that you'll be able to take that away with you. So for this year, we decided to focus on the topic emerging issues in pharmacy, and this is our first webinar in the series, which which we have partnered with APN. And just as you've seen, we talked about nurturing future pharmacists, and we want to be able to show people that there are then issues that are well known, but there are also issues that continuously emerge in healthcare, and that's what we're trying to also tackle. So for this year's World Pharmacy Day, we've been led by two people, that is Brian Mugambi and Karen Jepkoech, who will be doing the presentation on behalf of the whole executive. They have been guiding us and taking us through all the steps. And I can say without fear of doubt that the World Pharmacy Day is going to be quite exciting. And we hope that you'll come ready to have fun and to enjoy yourself. So with that said, I'd like to maybe hand it over back to Karen to be able to take us through the presentation. And it's an honor to be here with all of you today. And in case of any questions, please feel free to ask. So Karen, over to you.
Thank you so much, Lewis, for that. I hope you're all doing well. Lewis, is there anyone who's going to help me with the presentation?
The presentation is already live, so Juliet is sharing it for us. Yes.
Okay, thank you. So, good evening, everyone. So, my name is Karen Dekoech, and I have the privilege of representing KEPhSA in the capacity of the treasurer and also one of the team leads planning this World Pharmacy Day that will be held on 27th of September at UN. So I'm honored to be here today, and I would love to walk you through the plans that we have for our local chapters, the 9 local chapters, including the pre-Olympiad and all the activities that we will have between now till the 27th on the day of our celebration. And this presentation basically will highlight the activities, the opportunities, and the experience that we have lined up for everyone. And also want to thank APN for the opportunity to partner with us to bring the resources that they have and the mentorship they have for us. We really do appreciate, because we understand that you're also an organization that is trying to make an impact, and involving us really means a lot. So if you can move to the next slide. Okay, so as you all know, the World Pharmacy Day is celebrated globally on 25th of September. And for us, KEPhSA, it's more than a date on the calendar. It's a season for learning, connection, and celebration. And it's one of the major events that we normally look forward to. Most of you really love the World Pharmacy Day, and it's always a grand event because we have all the 9 pharmacy school. We're always 600 to 700 students, which is a good experience to interact with fellow students, with mentors, and with pharmacists. So for us, this year now, for all who are aware, our theme is think health and think pharmacists. And this was set by the International Pharmaceutical Federation, the FIP, and we are marking the occasion with a full month of activities, which are designed to bring the pharmacy students together from all over the country. So now that we all know the theme, I hope during the World Pharmacy Day we'll still remember the theme. It's quite short, so I don't think anyone will forget about the theme. Thank you. We can move to the next slide. Okay, so here before the 27th of September, we'll be having online events. We'll be having the pre-Olympiad, and the dates are clearly shown. So between the first, our calendar is packed with exciting events, as you can see. We'll have the interactive webinars. We started off with this webinar with APN as a collaboration, and we are so encouraged by the turnout. We really hope we maintain the same spirit, and we also hope that we have more online activities with APN. And also, and during this interactive webinars from last year, I think most of you saw what we did. So apart from the interactive webinars, we'll be having and most of you are familiar with and an avenue for all the students here to apply their knowledge and practice. And for most of the pre-elected events will be online. Then for founding, that will be done on the day end.
Excuse me, Karen, you are breaking. No?
And this is just to ensure that the
No?
and take part. We understand that currently that people are on holidays, some are and some may not be able to make it for the World Pharmacist Day, but this is still an opportunity for everyone here to create, to engage, and just feel part of this celebration. So it's just a blend of activities to ensure that we all take part.
Karen, I think we lost you.
Yes, we have Karen or Levis. Are you in? Please coordinate with Karen because we have lost the both of you. We cannot hear.
Yeah, I'm still here. Let me just follow up with that really quick.
Okay. Okay, so while we are getting Karen, Hilda, I just want to hand over the session back to you as well. And maybe we can have Kelvin take us through the MOU. Then we can engage on the activities lined up for us in the month of September.
Yeah, that's in order. Okay, so let's just give Levis really like some few minutes, and then they can just finish up on their presentation after Daktari. So we see the word treasurer and we are happy, very happy because there's always some sort of money involved. So we see the word treasurer, we are happy. So we are very happy to see that there's a treasurer in the room because obviously there's something good that is lined up for us. So Dr. Kelvin, so please just introduce yourself. Tell us just a little bit about yourself. Whatever it is that you want to share, you can tell us how much you love music. We don't have a problem. And then Dr. Kelvin will be presenting a little bit on the partnership, the scope, and the opportunities that are available for us as pharmacists. So welcome, Dr. Kelvin.
Thank you very much. Good afternoon. That is Hilda, right? Hilda, thank you very much. And good afternoon, good morning from wherever you are joining us. My name, as has been mentioned, is Dr. Kelvin Odongo. I am a pharmacist. It's a humbling moment to be here with all of you because it's a moment of reflection. A couple of years I was where most of you are probably are. I'm an alumni of Kenyatta University, and it's an absolute delight to get this opportunity to really have this discourse with, the future and the present of pharmacy practice in really the world. When we think pharmacy as African Pharmaceutical Network, we think about it from a global perspective. So if you're on this call and you are thinking about pharmacy practice in Kenya alone, I will start off by changing that mindset that we are actually global leaders in our own respect. A little bit about myself. So I currently serve as the treasurer for African Pharmaceutical Network, also supporting operations, working closely with Juliet and the rest of the directors. Apart from that, I am hugely involved in corporate healthcare. So when you think about any insurance company that covers on medical, I work with an organization supporting insurance partners when it comes to chronic disease management. Yeah, so as some of you might be aware or maybe not, that lifestyle diseases are becoming the next pandemic if we do not do something about them. And so my role as a pharmacist, and leaning more towards project management and operations side, is to be able to be part of that team that works with the patient, their insurer, to make sure that they're able to get access to quality, affordable, reliable medicines. Okay, how we do that is working with a team of young pharmacists, essentially, who are then able to walk the journey with the patient in terms of ongoing follow-ups. I also work with a women's health organization, where again, you can already tell that I'm driven by impact. We are trying to extend our reach to underserved communities around Nairobi, for starters, to be able to ensure that women have a personal doctor without having to worry about breaking the bank to access these services. So our response to women is, when they think women's health is not, have you seen a gynecologist? It is more around, we'll actually link you to a doctor that you can afford and who will work with you, leveraging telemedicine and what have you. Other than that, delighted to be here. And I'm just going to quickly shift to the conversation around the partnership. Thank you very much, Levis and team, for putting this together. Really, it's one of the areas that for a long time we've wanted to be able to impact. So you've seen we've had quite a number of partners, as Juliet was walking you through where we started, even including Empower. One of the things that for us has been a constant burden is, what can we do for learners here in Kenya, right? So that started the conversation with what you see now as a culmination in partnership with PSK, but also PSK YPG, and now KEPhSA, which is really the bigger body that you represent. So what is in it for you in terms of this engagement? Why did we think it's important? And Judith, just feel free to move to the next slide at this point. Why is it important? Why did we take time to meet with your leadership to discuss this? Juliet, if you could move my slides. I don't think they've moved yet.
They've moved, but let me stop sharing and reshare.
Yeah, maybe stop sharing and then share again. And I'm happy to hear in the chat. So I see a lot of questions in the chat. We'll get to them. So feel free to keep sending them. I'll spend very short time here, and then we come back and really dwell more on what the audience wants to know about this, the scope of partnership. But feel free to also type in the chat. So while Pharmacist Day is coming up, please feel free to type in the chat for the benefit of Levis and team what your expectations are, so that they take that into account even as we're looking at this. But yeah, that's it. So APN, KEPhSA partnership, right? So Juliet did mention that one of the things that for us is really a big deal is being able to impact the pharmacy practice in the area of professional development and mentorship. I remember when some of us were in school, and I'm not too old, but when some of us were in school, one of the challenges we had is really being able to get, one, be market ready, right? And being market ready beyond just the traditional, or you finish school and you can either work in a community pharmacy or work in a hospital or work in an industry. We did not get the privilege that you get today of learning what are the niche areas that are coming up in the market, okay? And how do you actually prepare yourself to be market ready? Because you're going to graduate how many a year? About 500 plus, right? And all these people are getting into the market. Where are the jobs? People may ask. Why we want to do this deliberately with you is, first of all, to co-create and design career talk series for you as students. Okay? Why? Because we want to expose you to what the myriad of careers that you could potentially tap into within the profession. It is high time that we stop thinking about the pharmacist just at the counter. Thinking beyond the counter is really why we want to do this, okay? We want to also collaborate with really KEPhSA and you as the stakeholders, the students, to also be able to design programs that make sense for you when it comes to mentorship, okay? What do I mean? That you're probably seeking, you probably have an idea of where you want to be, or maybe not. The mentorship that we seek is one that is practical, one that will also be designed in a way that makes sense for you. So it could be in form of group sessions, or it could be individual one-on-one sessions. We are willing to do that. We just need to be able to curate that in a way that makes sense, considering your class schedules and also considering the APN capacity on this side. But that's one of the things that, while we might not have gotten it, or some of us in the leadership at APN might have gotten it and seen the role it plays in just leaping forward, we want to extend that to all the learners in Kenya as much as possible. The next bit is really advocating for workforce development, okay? And in this case, mobilize resources towards the same. So you probably have heard from Juliet's introduction about the Pharmacy Academy, and someone had asked in the chat, what are the other courses that you've actually developed in this regard? So the Pharmacy Academy is a subset of part of the work that we do at African Pharmaceutical Network, with the goal of continuous professional development with very practical skills and knowledge. So what do? We have practicing professionals who are then the faculty members. So why do we insist on practicing professionals? So that you get the latest real world evidence and practical, so that I'm not talking to you about something that happened in the 80s when we're in 2025, okay? These individuals are the ones then who walk you through a period usually of 12 weeks. Our short courses run for 12 weeks. They are in the areas of regulatory affairs, patient safety and pharmacovigilance is the other course that we offer, and then finally, pharmaceutical supply chain management. And we have a few more that are in the pipeline, including digital health that we're thinking about. And during that period, you're then able to, they're held virtually, so you are able to also integrate your schooling and this virtually in the evenings once a week. Finally, is we want to be able to collaborate on networking. So you see the word network in our name. It is an opportunity for us to be able to plug you to networking opportunities through co-hosted events. You probably, if you attended IPSF at the USIU, you might have benefited from those networking opportunities and collaborative efforts that we've been able to put in place. And we want to expose KEPhSA to our wider network of people that you could potentially collaborate with as industry stakeholders. Juliet, you may move to the next slide, please. It's stuck from my end still. Okay, I think it is moving. Next. And I want to be mindful of the time you'd allocated me. Great. So just very quickly, this is building up on some of the things that I've talked about. What are the benefits for you as a student, as a member of KEPhSA? I should emphasize on member of KEPhSA, because if you're not a member of KEPhSA, these benefits unfortunately do not apply to you. You'd want to really ride on your organization to make sure that you reap these benefits. One is career guidance and mentorship opportunities. I've spoken about this. One of the things that we deliberately do for all people who are in the pharmacy academy is that we help you actually design your CV so that it speaks to your capabilities, it speaks to what it is that you are actually able to execute on. In my day-to-day role, one of the things that is quite unfortunate that we see, especially with medical professionals, is that we do not know how to sell ourselves. We are gifted, we are brilliant, but then packaging is everything, all right, in really the world out here. And so we deliberately work with all members of the Pharmacy Academy as part of their training with us and also members of APN to be able to design a CV that actually makes sense. Okay. The next bit is continuous professional development. For you as a member of KEPhSA, you would enjoy discounted rates. Okay. So that instead of paying $300, because each of our courses go for $300, you would pay $250. Okay. By virtue of the engagement with KEPhSA, you would enjoy more and more discounts as we go along. Next is with regards to networking events. So towards the end of the year, we usually have a networking dinner for everyone who's trained with us. There is nothing that stops you as a KEPhSA member from actually registering for such an event and joining us so that you meet the wider network within APN. These usually includes even industry discussions that are most relevant. If someone could type in the chat one relevant industry discussion that you may be aware of right now, please go ahead. I'll have a look at it even as we proceed. I want to see how current some of us are. Participation in APN projects through communities of practice. So what are communities of practice? Within APN, one of the things that we came very alive or aware to, the fact that within our network, there are people who are leaning towards different areas. And so we thought, okay, why don't we find a way in which people with similar interests are able to come together and then they can actually engage meaningfully in that particular space. So we formed different groups, what we call communities of practice, which is made up of professionals who have a leaning towards certain areas. So for example, pharmacy education and training, or you have an interest towards regulatory affairs and policy, or you are interested in clinical research and development, for example, or PV and patient safety. PV is pharmacovigilance, or maybe your interest is in pharmaceutical supply chain management and you just want to transform that space, okay? Or you are keen on trade and innovations and access like myself, or finance and investment. How do we actually get investments in healthcare in this industry? Or pharmaceutical care and clinical pharmacy, which is what I used to be passionate about before my interests changed. Or maybe you're here and your interest is in community pharmacy practice. Those are the current existing communities of practice that we have. And so as a member of African Pharmaceutical Network, by extension, through the partnership we have, if you decide to become a member of APN, then you would get an opportunity to actually join those communities of practice and be able to now engage with fellow members. What do we do in those groups in terms of communities of practice is that we meet every so often and the discussions are around, is there a project that we need to do? Oftentimes the parliament asks for input from the industry around different policies. And for a long time, only PSK has engaged in this. But one of the things you need to realize is that if you do not engage in politics, politics is going to shape your practice. Why we are here today and people are not getting posted directly into government absorption as it used to be before is because of politics. And I think more and more healthcare professionals are learning, okay, we cannot stay away from this game. So one of the things that we do actively is actually lobby, and we're able to then give our input with regards to current legislations that could affect current and future practice. Beyond that, we also take on projects that are relevant to the network's course. Juliet, if you could move to the next slide, I think I'm almost coming to the tail end of this. And while at it, as I'm waiting for Juliet to actually move to the next slide, the RA course is purely online with very practical sessions, actually. So one of the things that we do in terms of your training is you would actually be given assignments that are very relevant and require you to kind of think through. We also walk you through demonstrations of different regulatory portals that you would need, whether it's the PPB one or it's the Tanzania one or a different industry. Juliet, your slides have not yet moved. So I hope I've answered Wangari with regards to whether the course is purely online or if there's hands-on practical or in a pharma industry. So we are currently working on seeking partnerships for internship placements post the training. As you may know, that is a cost to the organization being the ones who host the intern. So we've not yet really secured that, but it's something that we are actively chasing at the moment. For some reason, I cannot see your slides, Juliet.
Okay, can you stop sharing again?
Alrighty.
And they're coming up. Now?
So maybe they can see it. I cannot for some reason. Perhaps let me try share my screen.
Okay.
Cool. Let me know when you can see my screen.
Yes. So,
You can, huh?
yes.
Wonderful. Awesome. Okay, so let me just move quickly to the next slide. Okay. So before I come and rest on this slide here, this year's focus in nurturing the next generation of professionals and leaders, right? Before, just to put into context the work that we are doing and inviting you as a member of KEPhSA to really reap the maximum benefits for as long as you're a KEPhSA member, we want to be able to understand what it is that for you as a student you care about. And please feel free to share that through the KEPhSA leadership so that we are actually designing solutions that make sense for you. Okay? One of the things over and above what I've mentioned for you as a student that you will gain from our engagement is for you to get a better understanding of pharmacy practice and the industry trends, even before you get to practice. Some of us were learning as after we got into practice, and we're like, okay, so that changed and that changed and that changed. It's no longer what we thought it was when we were in training. We want to afford you that platform so that anytime a PN is doing something, we are open to actually partnering with KEPhSA, and you as a student, please jump on that train. Okay. Some of the areas that we will give you insights on are, for example, industry pharmacy practice areas like research and development. How do you move from research and development to commercialization, right? Commercialization in this case meaning us now being able to sell the product, whether it is medicine or it's a medical device. The next bit is on clinical pharmacy practice areas, all right? More and more the world is moving towards patient-centered care. What does this even mean, all right? And practically, what does that mean for you as someone who's interested in that area? Community practice is changing immensely. I used to practice in community pharmacy. I ran a community pharmacy of my own, and the patient more and more is demanding self-care. So teach me to take care of myself, and the pharmacist has a very pivotal role in that. We want to expose you to that. Primary health care and public health interventions in community settings. What can we do? All right. Specializations and specialty practice areas. What are the emerging areas that we can actually start to prepare ourselves, all right? Because opportunity really will favor those who are prepared. Digital health, I mentioned this is one of the areas we are actually putting together some training material around in terms of a short course. We are in the age of AI. How does this tie to pharmacy practice, right? Technology, how do we tie this to pharmacy practice as much as possible? And so I want to pause there because I've come to the tail end of my presentation and take any really, I think I should hand it back first to you, and then happy to take any questions after that. Thank you.
Hilda, can confirm that you can hear us. Okay.
I think Hilda is on hold.
Yeah, Hilda.
So maybe Davis and team could also jump in. And
Okay, she's
Juliet,
back.
at this point, feel free to also share some of the OAIC you would already shared so that the members have an easy time. Fantastic. Great, great, great. So for those who had questions, Juliet, just go through so that we make sure any questions that the members may have. Someone had asked about member registration that has been shared in the chat. I saw a question around the courses. So those have been shared. We are currently enrolling the last cohorts, really, of for regulatory affairs. We've actually closed the enrollment. Some of you might have benefited from the scholarships we offered during the IPSF World Congress, at USIU. But feel free to also dialogue with Levi and team should you need any information and guidance. And Juliet is projecting the courses that we currently have in offering. Someone has asked, and Hilda, feel free to let me know when you're back, please.
I'm back. I'm sorry.
Fantastic.
I'm here.
Then back to you. It's all right.
Oh, okay. So sorry for that technical difficulty. Living in Safaricom in Kenya, it's not that easy. So thank you so much for your presentation. I don't know if the audience, I'm sure the audience, I'm seeing we have like about 150 people. So let us just send our reactions to the good presentation that you've just had. I told you guys, when you see treasurers, you're happy. And they have talked about some of the discounted prices that we have just because you're members of KEPhSA. He has talked about a networking dinner. Those clothes that you are hiding in your closet waiting for a good day, for like a day to wear them, you can wear them to the networking dinner. I think details and information on the networking dinner can be shared too. You can just tell us, you mentioned that you've not given us like a date which the dinner happens. So those clothes, we can start looking for them so that we can come to a dinner looking presentable and good. But either way, thank you so much for that. You've also said something that has really caught my attention, that if you don't engage in politics, it will shape your profession. And that is very true for whatever it is that we're seeing happening in Kenya today. I don't want to speak so much because if you become a little controversial in Kenya, you end up in a trap. So, okay, I think you're really doing a good job of multitasking. I don't know if we'll even have a Q&A session because you are presenting whilst answering questions while doing all that. So the chat box is very much open to the audience. If you have any question that you want to post again, so keep them coming. Keep your questions coming. Other than questions, you can just share a little bit on your thoughts, your views, and something that you just wanted to share with us. I hope Karen is back. So that Karen, you can finish up on the KEPhSA presentation and also wrap up about KEPhSA and the MOU. So Karen. Okay. Levis, Itau, are you in?
Yes. Yeah, I'm here.
I
Hello,
think
can you hear me?
yes, we can. So are you taking us through the presentation or Karen? Because I'm not, I cannot see Karen in the meeting.
Yes, she's not in the meeting.
I thought Karen had joined. Okay,
Yeah.
that's okay then. So I think I can just proceed. Okay, that's okay. Or maybe, yeah, so, okay, so can I request if Emmanuel Lihanda is also in the meeting?
I can confirm that for you.
Okay.
Okay, Lihanda is in the room and I'm making him a presenter, so he should be able to have his mic on and video on as well. Lihanda, please confirm that you can hear us. Your microphone is enabled.
Yeah, so I'll just hand it over to Lihanda if to take us through the presentation. Yes, so Lihanda, over to you.
Can you hear me?
Yes, we can.
Yes, we can.
Okay.
Yes.
Good evening, everyone. My name is Lihanda. I'm the KEPhSA vice president, so I'll be able to take over from where Karen had left. So maybe we can just proceed to the slide where she had left us. Yes, so we're going to be having online engagements beginning from this one for today. So our webinars are going to cover topics such as vaccination, family planning, and specialized care. So we're also going to have competitions, that is the Olympiad categories, which are going to test our knowledge, skills, and problem solving. And also, we're also going to be engaging together in our social media. So each and every member of KEPhSA is allowed to participate in the online activities. Participation in the online webinars contributes to the Spirit Award for your school. So now for the different webinars you're going to attend, that is the vaccination, the family planning, and the specialized care. The school with the most attending, it is going to add up on your points to become the best school with the Spirit Award. So we're also going to share a document showing the criteria of the awarding point criteria of the different categories that you're going to compete, so that during the final day now on the 27th of September at the University of Nairobi, you're going to award the best school in different categories. Also, participation in the Olympiad, we will be able to discuss in the next slide. APN are going to help us in providing you guys with certificates on participation for any webinar that you're going to attend. So kindly ensure that you create time to attend these webinars. You're going to get value out of it. You're going to be educated, and also at least you get a certificate to go with it at home. So yes, Juliet, you can proceed to the next slide. So the pre-Olympiad, the pre-WPD Olympiad, it is set to start on 10th of September. On 10th of September, we're going to be having the we're going to be having the clinical skills event and the patient counseling event. On 11th, we're going to be having the preclinical event and the general pharmacy quiz. Then on the 12th, we'll be having the industrial skills event and pharmacy management. So registration, if you're in any KEPhSA group in the WhatsApp, our contact person, Nyanchoka, has just shared, I think a few minutes ago, a poster containing the link for registration. So registration is open from now. The deadline is 5th of September. And also, only one team per school for each event is supposed to be allowed to register, and you can only participate in one event. So in a case, maybe I'm representing my school, so from KEM, so I register for the clinical skills event. I'm not allowed to register again for the industrial skills event. The moment I register for clinical skills, I only focus on clinical skills. And the winners, once again, as I've mentioned, the winners are going to be recognized and awarded during the WPD ceremony. We can proceed. So finally, the grand celebration day, it's going to happen at University of Nairobi, as you've already heard, main campus, the Chandaria Hall. It will be a physical gathering bringing all chapters together, the 9 chapters that are represented by KEPhSA, that is from USIU, Kabarak, KU, KEMU, UON, MKU, Maseno University, Kisii, and my niece, JQuat, and JQuat. So we are going to be having workshops and side events. these workshops are going to be engaging. So part of the side events that we're going to have, we're going to be having like a session for AMR. We're going to also have a session for mental health. We're also going to have a session on nutritional health. So, and also we are planning to have a session on research. So anyone is allowed to join any session that you feel you are more interested in, or you feel that you can be able to get more value out of it, and also that you're going to be allowed to network with. And also during after our opening ceremony, we're going to be having a financial literacy. As we have been told, most of us, okay, as much as we don't know how to market ourselves, once we realize how to market ourselves, we don't know how to store what we have already gathered. So we saw it wise to invite, we're trying to partner with Old Mutual. So they're going to also to educate us on how to manage our finances. So once you finish your pharmacy, once you start getting that money, or even if you're already earning right now, ways in which you can be able to manage your wealth, so that once we are out there in the society, kitu akando daktari, usikuwe daktari naona kitu kwa mfuko. And also other competitions, we're also going to be having our compounding event. So for the compounding, also those who are going to participate in compounding are going to register in the link that has been shared. So compounding will also be happening side by side with the other side events. And after that, we are going to be having a team building competition, which is going to involve sack race, egg race, tug of war. And also this one is going to add up in our spirit award, the spirit award criteria. So for you to be able to emerge the best school in terms of spirit award, it is going to be a combination of these webinars that we have planned, from nutrition, family planning, and also now the final day, the team building competition, so that can be able to emerge the best. So once again, registration for the physical day, it closes on 15th of September, and all payments for registration will be paid directly to your local chapter. All physical event attendance will be coordinated via the local KEPhSA chapters. So keep in close contact with your chapter leaders for guidance, your presidents, any leader from your local chapter. Then the registration for the side events and workshop will begin shortly after the Olympiad. So kindly, from today, the 1st of September, till 27th of September, just be on the look on any poster that is going to be shared in the different KEPhSA pages. And we are looking forward to you guys showing up and engaging, learning, networking. Yeah. So Juliet, kindly proceed. Finally, for the important dates, if maybe you joined late or maybe you didn't hear me, you can be able to just scan the QR code to download the official WPD month program, and you can be able to store it in your phone, so that maybe you can also set a reminder of your own. But just some important dates to remember. The 5th of September is the deadline for the pre-Olympia registration. 10th to 12th, we are going to be having our pre-WPD Olympiad competitions. 9th, 16th, and 23rd, we are going to be having the online webinars. On 15th of September, closing of registration for the physical day. And finally, on the 27th of September is when we're going to be having our World Pharmacy Day celebration. So maybe 1 minute or two to scan. Kindly can allow them to scan the QR code. If you have scanned it, you can just maybe react to show that we are together. Thank you. Thank you. I guess you can proceed. Maybe we'll be able to share it with you in our KEPhSA WhatsApp channels and WhatsApp groups, so that you can also be able to store it. So kindly proceed, Juliet. So you're all, once again, in making the 2025 WPD a success. Stay informed, register early, represent your chapter with pride. Let's come together and make 2025 WPD a memorable and an impactful celebration. And remember, all rules and regulations for the event must be adhered to, and any violations to the rules will be dealt with accordingly. So we're also going to share with you a document containing the rules and regulations, so that you can also be able, as much as you're having fun and engaging, we have fun and engage in an orderly way, and we present ourselves as professions that we are. So, yes. Next. Yeah, thank you very much. If you have any question, feel free to share it by the chat box. Thank you.
Okay, I think we have had Lihanda in the meeting, Karen, and also Gita Levis. And this just goes to show that KEPhSA is in really good hands. And I would love to just appreciate you guys, the executive, for making the time to be here for the very informative session that we just had. And yeah, so I think this is now time for the Q&A session, where we are going to, a lot of questions have been posted in the chat box. I don't know if there is any that has not been answered. So I'll just allow for any questions that have been posted to be, you can also ask the questions. And if there's, if you cannot express yourself through words, I think we can just, I don't know. Juliet, are you okay with, I don't know, this is now time for you to shine. You can now just give out some little bit of opportunity to some people who probably cannot express themselves better in a chat box, or who need some sort of like analogy or storytelling for their questions for this opportunity. So if there are any questions that have been posted to either Levis, Dr. Kelvin, or Juliet, please, this is now the time for the questions to be answered. And I think from there, I'll just have to hand it over to Dr. Kelvin, who is going, and Levis, who are going to be giving out the closing remarks. I think my time is done here. Please, I hope to see you guys APN at WPD 27th. There's no excuse. Oh, we did not know early. First, I think it's quite early. So we'd love to see you guys there. So thank you. Now the Q&A can begin.
Thank you. Thank you so much, Hilda. We really appreciate you. We appreciate you, Levis, as well, Karen, and Lihanda, for taking us through the overview of KEPhSA and what you have in store for us when it comes to the events scheduled for the month of September. We are really keen on those, and so we'll be there, we'll be participating. So I can see some questions, and I just wanted to address one that was shared to me. Yes, Levis, can see your hand is up.
Oh, sorry. I think I just what I wanted to say when I'm answering a question. So it's okay, we can proceed.
Okay, all right. So I have Wangari here, and she was asking, which other course did you introduce apart from RA? So apart from regulatory affairs, we have the pharmacovigilance and patient safety program, and we also have the pharmaceutical supply chain management program. And with all our programs, as Kelvin had mentioned, they're all delivered online. And we usually have our classes once a week. So for RA, our sessions are usually on Wednesday from 7:30 to 9:30 p.m. Then for supply chain and pharmacovigilance, our training sessions are usually on Thursdays from 7:30 to 9:30 p.m. So that is 2 hours. 2 hours once a week. The session is once a week for 2 hours, and we usually have access to the resources a week before the class. So the way the program is designed is that we are mindful of you. Even if you choose to enroll right now as a student, it won't be so cumbersome for you to keep up and to enroll and catch up with the classes we are going on. And then something that is also very unique about our trainings, for the cohort members that we usually have a diverse cohort. So when you're coming on board to train for any particular course, you will meet diverse kinds of people in your cohort, whether it is professionals who are joining us from different parts of the world, professionals practicing in different capacities. Therefore, you are able to gain even more value beyond that which you'll be gaining from the training and the content that has been prepared by our faculty. So you have a lot to gain when you train with African Pharmaceutical Network. And I also saw a question. All right. So Tanaka, I want to enable your mic. And I can see that your hand is also up. So let me just enable your microphone, then we can get to hear from you as well. Right, your microphone is enabled. Go ahead, sir.
Hello, good day to you all. I'm actually happy for this meeting and I really appreciate the presentation. I'm one of the students who's looking forward to the next cohort. And thank you so much, APVN, for the vouchers and all the organizing team at hand. My question is to those who managed to receive the vouchers, will the voucher only be for one course or it's for the cohorts for the 3 of them if you intend to join all of them? Thank you.
Thank you, Tanaka. And congratulations to winning the partial scholarship at the IPSF World Congress. So the scholarship or the voucher itself as it is, it only allows you to train for one course. So you just have to decide, oh, which particular course do I really want to train for? Is it RM, PV or supply chain, all right? So just decide within yourself and say, you know what, I'm going for PV. And that's what you'll get to train for. And that will be covered by the voucher. Okay, go ahead. I can see you have another question.
Maya, thank you so much for that. My other following question is that after attending the cohort after graduation, does it mean that you're automatically a member of APVN or you need a specific membership on top of attending the cohort? Thank you.
That's a great question. So for APN, now for you, if you get to enroll for whichever course that you want to enroll for, you'll be able to join the community of practice that is under the pharmacovigilance alumni. All right. So for every other person who has trained, they get to join our alumni group. So you're part of that group. So you get to join the alumni group, and then you'll also have access to 1 year free membership with APN. So for the first 1 year, you'll have free membership with APN, and then you can also get to join any other community of practice that Kelvin had spoken about. So whether it is PV or now you'd like to explore maybe pharmaceutical supply chain management or regulatory affairs and policy, you can get to join any other community of practice. So that is just for the first 1 year. Then moving forward, now you'll be required to renew your membership as you continue to become a member of APN. I hope I have answered your question. Thank you. Fantastic.
Thank you so much for the answers. Have a great day.
Thank you, Tanaka. Much appreciated. I have Nadine here. Nadine, your hand is raised. So let me enable your mic. Okay. Nadine, your microphone is enabled. You can go ahead and share your thoughts with us or questions.
Thank you very much for the wonderful presentation and the insight. So my question again is still about, I just wish to know, since the training is online, do we maybe get a placement after the training, like for you to actually practice maybe with an industry or something, maybe a referral or anything of that sort? So that's my one question. I don't know if I should just give other questions or one after the other.
Please go ahead, share the other questions.
Okay, the other question is about the voucher as Tanaka was asking. So mine is to know, like when I try to look at the enrollment, there is no option of you using a voucher or something. So I just wish to know, like, if you have that, what is the procedure for you to actually make use of it? And also maybe a breakdown of maybe how the activities are run maybe in a year. For example, if you do not want to use your voucher now, maybe how can you use it maybe next year because it's still valid? So maybe what is the breakdown so that we don't miss out on the enrollment period for maybe the interested areas?
Fantastic. So I'll begin with the voucher, then we'll get to the industry placement. So for the voucher, when you are registering on the link, there's the section where you have to upload a proof of payment. So for you, now that you have the voucher, what you'll be required to do is that on the back of it, you'll write your name and then you'll sign on it and include the course that you want to enroll for. Then that is what you're going to upload. Now, if you had received I'm assuming that you had received the partial scholarship because this was the only one that didn't have the names typed to it. So you'll just do that. When you upload it, you'll also be required to make a down payment of 10,000 Kenyan shillings or maybe 100 USD if you're paying in USD. Then once you have done that, you'll be able to enroll you. Now that you are saying an individual who has the voucher might not want to enroll in the current cohorts that we have, and the voucher the voucher expires after 1 year. That is, so by next year, that is on 30th or 31st, I think, of July, it will have expired. So in each and every year, we usually have 3 cohorts per training. So for RA, we'll have 3 cohorts, PV will have 3 cohorts, and supply chain will also have 3 cohorts. So between this time and the time when the voucher expires, you'll have an opportunity to enroll in either of the 2 cohorts that we'll have in that time. So either in January or in April. So those are the registration timelines. So you can register for cohort 1 in January or get to enroll for cohort 2 in April, because in May, cohort 2 training start. They all kick off in May. So you can take advantage of those timelines, all right? I hope I have answered you on the voucher.
Yes, thank you very much for the clarification.
All right. So on industry placement, as Kelvin had mentioned, currently we are still working on getting the placements for our cohort members. So this is in working in partnership with companies and different organizations that are able to offer us those placement opportunities. So at the moment, we are yet to have a majority or a number that is most convenient for any given cohort that we have. We may get 3 or 4 at particular times. So we usually don't want to overcommit. So these are usually very limited, but we are still working on getting more opportunities for our cohort members. So maybe by the time you are enrolling, which could be in 2026, we are hoping that we'll have gotten good placements for our cohort members. So stay hopeful. There is an opportunity. Kelvin?
Yeah, really nothing further to add, Juliet. I think one is for us important is ongoing stakeholder engagement to make sure that those opportunities are actually available. I say that also with a lot being very careful that these conversations take a bit of time, right? And at this point, it's also for the industry owners to say, okay, we're willing to accommodate APN learners in that regard. We, however, are very excited at what it is that we're already doing in the industry and the fact that various players in the industry see the value. And so we're positive that we would be able to move those conversations to a step where we can accommodate some of our learners for internships. One of the things I wanted to just add is the fact that for some of our learners, really for all learners, you are open to reach out for recommendations from APN. You're also open to reach out for guidance. Say you've taken on an RA role or a PV role, and you're not quite sure what to do about it or how to navigate various aspects. Yeah, the faculty as well as the broader network is always available for consultations and support. Yep. And it's not, we're not just talking about, because there was a question around, is this only relevant for Kenya? No, our trainings are designed with a global outlook, right? So you're thinking, if you're practicing anywhere else, would this be relevant for you? Thank you.
Thank you. Thank you so much, Kelvin. There is an international recognition through our courses through FIP. So when you check our courses, they all have the FIP seal, so they are recognized globally. If you check with them, our courses are definitely recognized with them. David, Kelvin, I'm not seeing any other questions, but I saw a question on membership, and an individual was asking if we have, if maybe as a student, I am an intern or a pre-intern, no longer a student, does the student membership still apply to me as well? All right. Does the student membership still apply to me as well? All right. So it applies for pre-interns. It will apply for pre-interns. For interns, maybe I will let Kelvin share on this, but it definitely applies for pre-interns and students. For interns, I don't know. Kelvin, what do you think?
You guys always like putting the Mr. Moneybags on the spot, eh? So currently, with the engagement that we have with KEPhSA, so KEPhSA all the way to pre-internship, and then after that, we currently actually treat this as an engagement where you pay the full amount. Maybe if conversations move to another level with the PSK YPGs, so that is for the Kenyan people, the Pharmaceutical Society of Kenya Young Pharmacists Group Leadership, and they, for example, negotiate for subsidized rates, then yeah, by all means, but we would, of course, make that public when that we get to that point. But at the moment, KEPhSA members, pre-interns, enjoy the same rates, and then internship, you pretty much pay the full amount. Thank you.
Thank you, Kelvin. I also have another question here from Tanaka.
So actually, one of the other ways to gain the discounts on the trainings is become an APN member. Then you get the discount by extension.
All right, so I'm just answering the last few questions on the courses and the membership. And then Kelvin, I'll hand it over to you. And then Levis will take over from there, because I can see we also have some questions that are directed to KEPhSA. All right, so regarding APN courses, do we also offer CPD points? Absolutely, yes. All our courses are CPD accredited by Pharmacy and Poisons Board. So depending on the number of modules that you'll be covering per course, you'll be getting at least 3 points per module. So for RA, we usually have 10 core modules, so that is 30 points. And then you'll also have an extra 2 points for the practical session and the guest lecture that we'll be having. So beyond the content that has been prepared by our faculty, when you're also training with us, we also give you an opportunity and expose you to professionals who are beyond our faculty. So